So my name is Dano. I'm going to be the nurse practitioner student taking care of you today. Pretty much what we're going to be doing right now is abdominal examination, which comprises of inspection, auscultation, percussion, and palpation. Before I start, it's very important for me to obtain consent and seek permission from you, because this video recording is going to be posted on YouTube, and this will enable my instructor to see what I'm doing. So I just want to make sure, even though I know I'm your dad, but I still want to make sure it's okay for me to post this YouTube, for you to say yes or no.
Yes.
Thank you. So I'm going to have you lay down on your back, being supine. Before I can do this examination, I'm going to start off by inspecting your abdomen, making sure there is no movements, pulsation, or any. I'm looking at the shape of the abdomen. I'm looking at the contour, looking at the peristalsis, which is the movement of the bowel movement. And I'm also looking at the skin tone, making sure there is no scarring, any striae, any rashes or lesion. And I'm looking at that. There's no lesion. I'm also trying to see if there's any discoloration or jaundice. I'm just kind of looking at the overall skin, making sure there's no tenting and all that. So with that, I'm kind of done with the inspection. So I'm going to move ahead and do the auscultation, which is going to require me to listen to all the four quadrants by using my stethoscope. And I'm going to start in the clockwise. I'm starting from the right lower quadrant, and I'm going to move ahead. So let me start by demonstrating that this is my stethoscope. All right, if you want to. So I'm going to start right lower quadrant, auscultating for vowel sound. And I'm moving ahead to the right upper quadrant. And I'm doing the right and left upper quadrant. Yeah. And I'm moving down to left lower quadrant. Okay. I'm trying to look for normal bowel sound, which is normal active. It should be between 5 to 30 seconds per minute. 30 count per minute. Any hyperactive, normal, but just have to kind of listen to the sound and detect that. Also, while I'm auscultating, I'm also going to auscultate for the hepatic splenic area of the abdomen with the diaphragm and the bed of the stethoscope, making sure in the splenic area. And I'm also going to auscultate the abdominal aorta, making sure there is no bruise. I'm going to move ahead right here on the umbilicus. It's above the umbilicus, about 1 inch. And I'm trying to listen for, making sure there is no bruise. I'm listening with the diaphragm and bell of the stethoscope. And I'm going to move ahead and listen to auscultate the renal artery on the right side, beside the aorta. I'm listening with both the diaphragm and bell of the stethoscope. I'm listening to the left with both the diaphragm and bell, making sure there is no bruise. I'm going to move down to the iliac artery right here, listening with both bell and diaphragm of the stethoscope. I'm listening on the right iliac, the last one is going to be the femoral artery, the right femoral artery right here, making sure there is no bruise. I'm listening with the bell, and I'm going to listen to the left femoral artery, the diaphragm and the bell of the stethoscope. So that kind of concludes the auscultation. I'm still going to have you lie down. The next thing I'm going to do right now is going to be percussion. So I'm going to percuss with the right dominant middle finger with the middle finger of the non-dominant. So I'm going to start by percussing all the 4 quadrants by starting from the right lower quadrant. What I'm listening for is the tympanic sound, making sure there is no dullness in all the areas. Okay, so all 4 quadrants, it's tympanic sound. So I'm also going to percuss the liver edge, and also the spleen. And I'm going to see where the sound changes from tympani to dullness. Right here, I'm going to mark, and I'm going to go above around the mid-clavicle area. So right here, the liver is about 7 centimeters at the mid-clavicle. That's the liver span. And on the liver head, it's about 1 centimeter at the costal margin. I'm going to also try and percuss the spleen. The spleen is pretty much hidden under the rib cage, so sometimes it could be kind of hard to percuss. While I'm percussing, I'm also going to percuss to check for any patients. Sometimes they have ascites, which is like an inflammation or the fluid in the abdominal cavity. The only way to check is whatever the water is, the fluid is going to be a dull sound. So I'm trying to percuss on the side. The way it's lying down right now, and there's other tests that could be done, the wave and the shifting. So I'm percussing on the right side. There's no dullness, and I'm looking on the left side. There's no dullness. So if I'm going to check the wave, I need to do this on the patient. If there's any wave, it's going to move, shift. And the other thing I can ask the patient to do is to stay lateral. Can you roll on the side for me? So if there's any shifting of the fluid, it's going to be, I'm going to percuss on this side for any dullness, for any tympani. So it's tympani. Can come back. So the next thing I'm going to do right now is going to be palpation, and I'm going to start off with light palpation before I can do the deep palpation. What I'm doing there is to kind of prepare my patient before I can apply any deep pressure. But also, if there's any mass that is not intended, that I didn't know about, by me doing the light palpation, it will kind of give me the opportunity to be able to locate where it is, and not to let the mass move away. So I'm going to do light palpation, and I'm going to start off from the right lower quadrant. And I'm moving ahead to right upper quadrant, and I'm moving ahead to left upper quadrant, then the left to lower quadrant. So I'm done with the light palpation. I'm going to start with the deep palpation, and I'm going to start off from the left, from the right lower quadrant of the patient, and I'm going to apply pressure, checking for any tenderness or any palpable mass. There's none. And I'm also going to move up to the right upper quadrant, checking for any tenderness or any palpable mass. Left upper quadrant, and then left lower quadrant. So there is no palpable mass and there is no tenderness. And I'm also going to do palpate the liver, making sure there is no enlargement of the liver. I'm going to hook my finger right beneath, right here, and I'm going to ask the patient to take a deep breath. Take a deep breath for me. Okay. Trying to see if my finger can touch the edge of the liver right here. Okay. I'm also going to do the spleen, same way, see if I can palpate the spleen. Pretty much it's going to be tough to palpate the spleen unless there's any enlargement. If I'm able to palpate the spleen, it's an indication for enlargement. So it's not palpable. Also, I'm going to see if I can palpate the kidney. It's not palpable. Also right here, the kidney is not palpable. So the other thing I'm going to look for, sometimes patients come in with abdominal pain, and sometimes they could be having appendicitis. So there are specialty tests that could be done to check for different kind of disease that is going on with the patient. The first thing I'm going to do, the specialty test that I'm going to do is called Murphy sign. And this is testing for any inflammation of the gallbladder, which could be diagnosed as cholecystitis. So the best spot to do this is going to be to palpate the right upper quadrant of the patient. And I'm going to palpate by asking the patient to take a deep breath. If the patient cannot take a deep breath cannot hold the breath during the inspiration or the cessation of the breathing, and there is sensation of pain, it means an indication for gallbladder inflammation, which is going to be diagnosed as cholecystitis. So I'm going to demonstrate that right here at the right upper quadrant. I'm going to apply deep pressure and ask the patient to take a deep breath from me. So it's negative, the Murphy sign is negative. The other test I can do is called ASIS, anterior superior iliac spine, which is the hip bone. It's going to be right here along the umbilicus. There's an imaginary line about 2/3 from the umbilicus. It's where the McBurney's point is. Below the McBurney's point, it's where the gallbladder is resting. So I'm palpating the area. If there's any tenderness or any pain, it's an indication for also appendicitis or peritonitis. So right now, patient doesn't react to the deep pressure or palpation, which is negative for that. Another specialty test to do is called iliopsoas sign. And this is done by asking the patient to bring the knee up and press against my hand. Can you press against my hand? So if there's any pain right here as the patient is moving his knee, it's an indication for either appendicitis or peritonitis. And also the last one, specialty test that is done is called obturator sign or obturator test. And this is also going to be done by asking the patient to flex the knee up about 90 degrees. And I'm going to rotate internally and externally. And if there's any pain, it's an indication for either appendicitis or peritonitis. The last one, so appendicitis. The last one I'm going to do is called tender test. To check for that, can you relax your leg? The tender test is by me applying a deep pressure right here, and I'm going to release my hand quickly, and if there's any pain right here, the patient is going to react to that, which is an indication for appendicitis. And the other one, which is the last one, is called rebound tenderness. So what I'm doing, the same thing that I did right here, which is tender test, I'm going to do it on the opposite side of the patient. I'm going to apply deep pressure, and I'm going to release my hand. And if there's any pain on the opposite side here, it shows that it's an indication for appendicitis. And if the patient reacts like, So this kind of concludes our abdominal exam. And thank you so much, Anand, for doing this with me. I appreciate it. Thank you, and have a good night.